Staggering statistic, more than 60 million women in the U.S. are living with some form of heart disease. In fact, heart disease is the leading cause of death for women, accounting for about 1 in every 5 female deaths. And still, we're not getting the help we need. Joining me now is nurse practitioner Lori Finley. Lori, it's great to see you again.
It's great to be here. Thank you so much.
So I can't believe the statistics. I mean, it's ahead of breast cancer. It's ahead of COVID. I mean, women and heart disease, it's a really serious issue.
It is. And what's even more staggering is that according to the New England Journal of Medicine, according to the Lancet Medical Journal, only 8 to 9% of women think it's their greatest risk, but it's killing 6 times as many women as breast cancer.
That's unbelievable.
It is really unbelievable.
So let's talk about hormones and how this all plays into it. Do our chances of dying from heart disease or contracting heart disease, does that go up as we get closer to perimenopausal, menopausal?
Absolutely. It skyrockets, right? It's like 1 in 5, right, at a perimenopausal. And in fact, you know, women have advantages over men when it comes to heart disease in our perimenopausal years. In fact, I love the quote that was in the book, Estrogen Matters. It said, you know, there's not very many places in our lives where women have an advantage over men, except in heart disease. Why would we want to give that up, right? Like they're reminding women like estrogen and progesterone are so important. So as we go through those perimenopausal years and our hormones drop, it does terrible things to our cholesterol. Our triglycerides rise, the bad LDL or lousy cholesterol rises, the healthy HDL cholesterol drops, right? Insulin resistance increases, the nitric oxide, which causes dilation of the vessels, that drops, the arteries become stiff. You get more visceral fat around your belly, which causes diabetes, which increases your risk. So all of these things happen as we age, and that's all because of the drop in our hormones.
So let's talk about hormone replenishment, which is huge now. And I know a lot of women are scared of it because back in the day, synthetic hormones, which were widely used, gave it a bad rap. But there's been a big paradigm shift, and there's a healthy way to do this that can actually prevent so many things and really help women age healthier.
Correct. Well, you know, I love there's an article from, it's actually an editorial from Dr. Lee Goodman, and it was in the New England Journal, and said, look, like we need to revisit this. 40 to 50% reduction in heart disease risk with bioidentical hormone therapy, right? With hormone therapy. 2 or 3 other studies, the Nurses' Health Study, the PEPI study, they all have come back and said, yes, hormone therapy actually supports us, and bioidentical, of course, is so much safer. It makes a difference because what it does is just the opposite. It will dilate the vessels. It will improve your cholesterol levels. It helps stabilize insulin resistance. So those hormones are honestly one of the biggest bang for the buck to support us with our health long term.
How long do you stay on hormone replenishment or replacement?
That's a great question. First of all, we want to make sure that women start at least within 10 years of perimenopause, of going on menopause. And it's like, why wouldn't you want to start it right away? Just like the doctors said in Estrogen Matters, why would we want to give up that advantage? So I recommend women start it immediately when they go into menopause. And you know, years ago, the adage was the shortest duration and the lowest dose. And now the recommendation is we should be on this for the rest of our lives.
Really?
Yes.
That's very interesting.
Right.
What if you're late to the party like me and you're way post-menopause and I just literally started this like 3-4 months ago?
Right. Still get on hormone replacement therapy, bioidentical hormone replacement therapy. It will start balancing out and supporting your lipids and your, like again, improving the nitric oxide so you get that dilation, stabilizing your blood sugar, all of those things.
What questions should you be asking your doctor or your healthcare provider to make sure you're not getting steered in a synthetic direction? Because, you know, I really, you know, I know that everyone raves about the pellet. I wasn't really comfortable with the pellet just yet, so I'm doing sublingual and I'm doing different things. But I made sure to say this isn't, because a lot of times the oral ones can be the synthetic ones.
Right.
But I made sure that it was coming from a lab, and I'm working with somebody that's very qualified. So thoughts on that? Like what should be asking?
I think, first of all, you should be asking if it's bioidentical.
Okay.
And with that said, you know, if we go back and look at some of the literature, even in the Women's Health Initiative of 22 years ago, when they said, oh, you know, hormone replacement therapy is terrible, it causes breast cancer, it causes heart disease and stroke, They went back and literally looked at that study with fine detail, and the population was much, much older. 70% of them were obese, or excuse me, 70% were overweight, 20% were obese, 50% were smokers. So it was and they started hormone therapy 20 years late, right?
Right.
So they were already in menopause for 20 years. So it was a very, very sick subset. And so I'm trying to encourage women that start younger. Make sure bioidentical is much safer, but start much younger and get on it. And of course, you know how I feel about the Dutch test. Get the Dutch test done and see what your hormone levels are, the balance between progesterone and estrogen, and make sure you're monitoring your hormone metabolism to follow up on, you know, your risk for hormone-related cancers. But when we start supporting ourselves with hormones, we're supporting our brains, we're supporting our kidneys. You know, small vessel disease goes from head to toe. So we're impacting our brain health as well. We're impacting our kidneys and our heart.
Interesting conversation, Lori. Thank you so much for coming back on Bloom.
You're so welcome. Thank you.